As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Welcome to Intelligent Medicine, America's foremost program on health, medicine, and nutrition, featuring the latest on both conventional and alternative therapies. Now, here's Dr. Ronald Hoffman.
Welcome to Intelligent Medicine. I'm your host, Dr. Ronald Hoffman. Intelligent Medicine is a program about the best of high-tech medicine, the best of natural therapies. Putting those together for you each weekend is my job, and I guarantee you, 100% guarantee, money-back guarantee is a free show, that you will learn something new in the course of today's broadcast. Perhaps many things, hopefully, because we've got a lot of interesting stories lined up for you. 877-726-8255 is our number. We're going to take a critical look at sound machines that are designed to help you sleep better. We'll also look at ways of enhancing the weight loss benefits of those popular weight loss drugs. And we're going to talk about the importance of your butt. Yeah, your butt actually has an overall impact on your health and metabolism, according to a recent study. 877-726-8255. And it is cold here in New York, where I broadcast from. We had a big snow dump about a week or 10 days ago. And now there's just gray globs of ice piled up on the city streets. Fortunately, they've now carved little paths so you don't have to climb over the ice to cross the street. But I've been in New York for over 50 years. I grew up in Southern California, then I went east to go to college here in New York, and I've stayed. And I cannot remember such a long stretch of sub-zero days here in New York during my entire residency here in the Northeast. And ice even is piled up in the Hudson River. And there's ice in the East River as well, although it's not really a river. It's actually what is called an estuary. So, we got a mixture of salt water, and we've got some fresh water, and fresh water freezes more than salt water. Hence, you've got a little more ice in the Hudson, which is more properly a river. And so a lot of people are suffering from cold fatigue. That is a term that we've now coined to describe the tiredness, the listlessness, the lack of motivation that people get when there's a long period of cold. We used to call that cabin fever, where people are stuck inside because of the inclement weather. And they say that 40% of people experience a drop in mood during cold waves, and there certainly has been one here in New York. One solution is to get away, and indeed producer Phil, who usually presides over this program, he was away last week. He took a week off traveling to Mexico and Belize and Honduras, the lucky stiff. And part of my solution to cold fatigue is I'm headed to Scottsdale, Arizona for a conference of the Alliance for Natural Health, of which I'm president. And it'll be a combination of meeting some great people and having some great discussions, and also exposure to a little bit of warmth. And I think I'm going to take some nice outdoor bike rides there in the hills around Scottsdale. So, yeah, cold weather is a thing. And there's an article here in Today's Practitioner entitled Cold Weather, Joint Physiology and Clinical Strategies. And they describe here why it is that we feel stiffer and we're more injury prone during cold waves. And indeed, part of it is that it's more arduous to walk on icy pavements and to climb over snowbanks. And then, of course, a lot of people get overzealous about snow shoveling, notwithstanding the fact that there are a lot of mechanical devices now that can do the snow shoveling for us. I like snow shoveling, but if you're not used to it, you can throw your back out, you can get real sore, and you can even give yourself a heart attack. There have been a few deaths due to that. There have been some deaths due to exposure here in New York. Some of the homeless, they don't want to come in from the cold, and so they may be under the influence of alcohol or drugs, and they don't feel it as the cold comes on. They try to sleep through it, and they end up frozen stiffs. That used to happen pretty frequently while I was a medical resident here in New York at Bellevue Hospital. They would bring in literally frozen bodies. And what's interesting about that is that you cannot pronounce a person dead if they are below a certain temperature, because there is the possibility of kind of reanimation that occurs when you thaw people out. It doesn't happen very often. But legally, we were obliged to warm people with warming blankets and warm intravenous fluids, bring their body temperature up to a requisite level, and only then could we pronounce them dead. It was really weird. But yeah, there are deaths due to that. But cold weather physiologically impacts joint health. And here's how that happens. There is soft tissue tightening and reduced elasticity, because they say as collagen-rich structures cool, their viscosity rises. It's kind of like motor oil. You know, you got the summer weight motor oil and the winter weight motor oil. And the winter weight motor oil is designed to be liquid and to flow properly at very low temperatures. It's different. And because of the increased viscosity, this leads to increased stiffness and reduced range of motion and mechanical resistance across weight-bearing joints. Well, one of the ways to deal with that is get a lube job. Yeah, not just your car, but your body. And you can get a lube job with omega-3 fatty acids, fish oil. And the reason for that is that fish oil is particularly abundant in Arctic fish and mammals. And why is that? Because it has a very low solidifying point. Butter will solidify at room temperature. You put olive oil in the refrigerator and it'll congeal. But fish oil, you put in the refrigerator and it's still liquid. And for that reason, it actually may help us with soft tissue tightening and reduced elasticity that comes with cold. Also, same thing happens with your synovial fluid, which is the lubricant and shock absorber within your knees and all your joints. Cold exposure thickens this fluid. And if you got compromised surfaces or early degenerative changes, this mechanical change can amplify the discomfort. So yeah, cold temperatures. Also, barometric pressure-related tissue expansion. People sometimes say that my knees tell me when we're going to be having a storm. And that is because drops in barometric pressure, which commonly precede winter storms, allow soft tissues, they say, within the joint to expand slightly. And this increases pressure on the nerve endings, which heighten pain perception. And finally, there's definitely reduced circulation, because what the body attempts to do when it's cold is it brings the blood to the interior. Why? Because, well, you don't want the blood to be at the surface, because while the blood is at the surface, the blood's going to freeze and you'll be in danger of frostbite. And so your blood is brought closer to your interior. you get what's called vasoconstriction. A lot of people have what's called Raynaud syndrome, like white or even bluish fingers and sometimes toes in the cold. And this also creates more of a problem. So what can you do? Well, warm up before you go outside, right? Don't just lace on your sneakers or your boots and head outside. Do some stretching. Do some stuff, that mobilizes your joints a little bit. Also, consider sauna. And this is something I've been doing more and more during one of the ways I've been trying to beat this cold away, both physically and psychologically, is after exercise, I get in the sauna for a while. Or the steam room. Unfortunately, I live next to a Y, so we have both a steam room and a sauna, and that's a great way to counteract the cold. At least you give yourself the illusion that you're in a warm place. I mean, you can't take a trip to Mexico, Central America, the Caribbean, to Hawaii or parts south. Don't bother going to Florida, because the temperatures there in Florida, there were actually some cute memes on social media, is that the temperatures in Florida, like Pensacola and Panhandle, were actually colder than the temperatures in Alaska and in Iceland. It was like 42 degrees in Iceland, and it's 28 degrees in Florida. It's crazy. You can also make sure you do strength training to support your joint mechanics and maintain flexibility. And vitamin D is a great way to counteract the cold, because it's time of year, you're getting less sunlight, your vitamin D levels are going to plummet. And remember to hydrate, because it is super dry this time of year. Literally, it sucks the moisture out of your skin. And I noticed the plants in my apartment are wilting, and I usually don't have to water them as much, but apartments are very dry. Interiors are heated, and the humidity is very, very low. And you can become dehydrated even if you're not sweating. So support adequate hydration, which influences your synovial fluid quality. Make sure you lubricate with fish oil and plenty of adequate hydration. So those are some of the things you can do to fend off cold fatigue and cold injuries. 877-726-8255. We can't do this feature during the summer, so I'm going to do it. Take advantage of the cold weather to share this information with you in a timely fashion. 877-726-8255 is our number. I'm Dr. Ronald Hoffman, and we'll take some of your phone calls momentarily. This is Intelligent Medicine. If you've followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman.
Subscribe to the Intelligent Medicine Podcast, updated several times weekly. Go to drhoffman.com.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman with your numbers 877-726-8255. That's not just a number for questions. If you have a comment, if you heard something on this program that you want to challenge, or that you've got some additional information to share with us about, comments, opinions, 877-726-8255. Okay, let's go. Let's hear one of the calls.
Hi, Dr. Hoffman. I do have a question. It's in reference to bone density and a fracture. I have osteoporosis. I'm recovering from a fracture of the vertebrae. So it really hit me right between my eyes because in the past, the osteoporosis kind of didn't frighten me. But getting this fracture in the vertebrae and going through some pain and a long recovery, I'm anxious to get on a medication. And I would love your recommendation. This is the first time I'm going to be taking something, and I really want it to work. So I would like your opinion before I start. So, if I was your mother, what would you recommend? I'm a small frame, over 75, 76 years old, 108 pounds at 5 feet tall. I really appreciate your information and your knowledge. Thank you.
Thank you very much for flattering me by saying that you might be my mother, because in order for you to be my mother, if you're 76, you would have had to have born me at the age of 3, because I'm 73, so I'm not that far off in age from you. So this really is a wake-up call for you, because we see people with reduced bone density, and then they're put on medication, but this is an example of it's really imperative for you to get on medication, because you obviously have such a severe reduction in your bone density that your spinal column is literally collapsing. And it may be something that occurs with a movement or a jump or a fall, but it could actually happen spontaneously, just stepping off a sidewalk and like, wow, pain in the back. And then you get an X-ray, CT scan, or an MRI, and you image it, and you say, oh, there's a vertebral column that has collapsed because the bone is so weak. And so it used to be thought that one of the ways to treat that is to use kind of a glue gun and put in kind of a glue-like substance into the vertebra directly to shore it up. And this procedure was done for quite some time, but then studies revealed that it doesn't really help. It doesn't really help the long-term outcome of a vertebral fracture. It certainly doesn't prevent subsequent vertebral fractures. So it's been kind of cast by the wayside. It's an example of medical procedures which don't really pan out. So treatment for you would be Forteo, and followed, taken for a couple of years, and then you must afterwards take a medication like Actonil, Boniva, one of those bisphosphonate medications, because once you stop Forteo, there's kind of a quick rebound of bone loss. So your doctor will know this, and your doctor will put you on an appropriate therapy. Also, make sure you have adequate vitamin D. Consider hormone replacement therapy, although sometimes women a little later in life don't like to start hormone replacement therapy. These are some of the things that you need to, but this is a case where just supplements alone won't fix this. 877-726-8255 is our number. I'm Dr. Ronald Hoffman, and you're listening to Intelligent Medicine.
Now, more than ever, it is important to have a healthy immune system. Many health professionals agree that probiotics are a leading natural therapy for boosting immune health. Why? Because 70% of your body's immune cells reside in the GI tract. By taking a superior probiotic daily, like Dr. Ohhira's probiotics, you can enhance your overall immune system and immune response. The key to Dr. Ohhira's success is the 500-plus postbiotic metabolites that are in each capsule. Postbiotic metabolites are important to the regulation of most systems in our body. For a short-term immune boost, try Dr. Ohhira's Propolis Plus. Merging nature and science, Dr. Ohhira's Propolis Plus combines Brazilian green propolis, vitamin E, astaxanthin, and tocotrienols for additional and powerful immune support. Be proactive about your immune health. Ask your retailer today about Dr. Ohhira's probiotics and Dr. Ohhira's Propolis Plus today. Also available online.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Subscribe to the Intelligent Medicine Podcast, updated several times weekly. Go to drhoffman.com.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here. Our number is 877-726-8255. And here is a study about those sound machines, those soothing, what is sometimes called pink noise, might be making your sleep worse, according to a study. And often people opt for the soothing sounds of a forest, gentle winds, wave sounds, things like that to lull them to sleep. And it's an appealing idea. In fact, it's so appealing that the 5 most popular YouTube videos associated with the search term white noise have accumulated more than 700 million views, and white noise and ambient podcasts are available. They account for 3 million hours of daily listening on Spotify. So you can actually listen to it like a white noise podcast. You can turn it on at night, or you can buy a device which delivers various types of white noise. Another way that people use these things is they use them during plane flights, and they use it partially to offset the plane noise. Now, you can use noise-canceling headsets, but they only partially get rid of the sound, the kind of, the flight sounds. And so this study actually was partially funded by the Federal Aviation Administration. And they wanted to see how white noise, or pink noise, sometimes referred to, has an impact on sleep quality. And there are also natural sounds that come from household devices, such as fans and air conditioning systems. And they produce, along with rainfall and ocean waves, something called broadband noise. Okay? Now, definitely aircraft noise led to an average loss in these volunteers of about 23 minutes per night of what's called N3 sleep, which is the deepest sleep stage. And earplugs mitigated that. So earplugs seem to be the best way of addressing that, rather than masking it with pink noise. So the pink noise played on its own at 50 decibels, which is compared to the sound of a moderate rainfall, was also linked to a nearly 19-minute reduction in REM sleep. That's the important part of sleep that's restorative. When pink noise was combined with aircraft noise, as someone perhaps on a plane flight might use their headphones to pipe in the sound of waves or rainfall or whatever, forest sounds, whatever they do. When it was combined with aircraft noise, the effects were actually additive. Both deep sleep and REM sleep were significantly shorter, and participants spent an additional 15 minutes awake during the night. And participants also reported that they felt that their sleep was lighter, they woke up more often. The researchers said the results support the effectiveness of earplugs. Earplugs definitely work. And they're actually used by 16% of Americans to help them sleep. So look, not every person is fortunate enough to live in a very quiet place. If you live in a city, in an urban environment, you want to keep the windows open. In the summer I keep the windows open, but then I hear the the garbage trucks, because they come at night. Earplugs are used by 16% of Americans to help them sleep. Millions of people still rely on continuous background noise every night. And that is a problem because disrupted REM sleep is commonly seen in conditions such as depression, anxiety, and even Parkinson's disease. And a particular problem is that children may be more vulnerable to it. Children spend significantly more time in restorative REM sleep than adults as part of their physical and emotional and neurocognitive development. The brain is actively developing and changing and forming connections in children, which may make them especially sensitive to the disruption of REM sleep. And despite that, many parents place sound machines near the beds of newborns and toddlers. They think it's going to help them fall asleep and stay asleep, but au contraire. The researchers report overall results caution against the use of broadband noise, especially for newborns and toddlers. And we need to do more research in vulnerable populations. All right, I was talking earlier about doing a lube job on your joints and muscles during the winter with omega-3 fatty acids. And here's my choice these days for omega-3 fatty acid supplementation. And we also have to remember that our brains are made mostly of fat. So if somebody calls you a fathead, that's a compliment. But why not nourish your brain with the highest quality omega-3 available? Omega-3 Rejuvenate comes to us from Big Bold Health. Omega-3 Rejuvenate is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon. It's sourced from the pristine waters of Alaska. And this is not the story of other brands. The fact is that most of the world's fish oil products are produced from several types of species, packed into nets in commercial fishing zones, loaded into the holds of vessels that stay out for days or even weeks, and then put into processing plants that treat them with harsh, high-heat chemicals and synthetic nutrients. Big Bold Health does it differently. All of it straight from the sea into the hands of skilled fishermen, instantly flash frozen, taken to their specially designed shoreside plant, using a low-heat extraction technique to extract the pure amber omega oil. And you can see the difference. The capsules, they're like beautiful amber color that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, and DPA, plus all naturals, vitamins A and D, and naturally occurring pro-resolving mediators that are vital for supporting cardiovascular, cognitive, and immune health. Their unique low-temperature extraction preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. There's no fillers, no shortcuts, just pure, potent wellness. So visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate, and use coupon code Hoffman20 for 20% off site-wide. And they also have a great product called Himalayan Tartary Buckwheat, which is a wonderful longevity supplement. And they've got it in, powders. I made HTB Himalayan Tartary Buckwheat pancakes the other morning with the HTB flour. So bigboldhealth.com/Hoffman for Omega-3 Rejuvenate, and use coupon code Hoffman20 for 20% off all their products. All right. A lot of women, and a lot of men, but a lot of women are taking GLP-1 medications, and they're losing weight. And here's a way that you can accentuate the benefits of the GLP-1 drugs if you're a postmenopausal woman. Very interesting study. And they looked at Mounjaro, which is these days possibly the most effective of the GLP-1 drugs. It's a dual action drug. It's a GLP-1 and a GIP drug. So it combines two actions to produce even more remarkable weight loss. And they did a study at the Mayo Clinic on postmenopausal women with overweight or obesity treated with Mounjaro for over 12 months. And the women were overweight, and they some of them were taking hormone replacement therapy concurrently with the Mounjaro, and others were not. And what they found is that there was a dramatic improvement in the weight loss in the women who simultaneously took Mounjaro and took hormone replacement therapy. The hormone replacement therapy group lost more of their percentage body weight than the no hormone group. And the difference was about 5% more weight loss. So a higher proportion of women in the hormone therapy group reached a total percentage body weight change of greater than 20%, or greater than 25%, or even greater than 30%. And both groups had improvements in their blood sugar and their blood pressure and their concentration of liver enzymes, because that's another thing that these drugs do, is they alleviate fatty liver disease. But there were additional reductions in diastolic blood pressure, concentrations of triglycerides, and a liver function test called ALT in women using hormone therapy. So the way they boil it down, they say that these findings suggest that hormone therapy might enhance the therapeutic effects of Mounjaro in this population. So if you're taking weight loss medication, if you're a woman, and you haven't yet considered hormone replacement therapy for menopausal, consider that and get an additional benefit. 877-726-8255, our number. I'm Dr. Ronald Hoffman, and this is Intelligent Medicine.
You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com. As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
drhoffman.com, your portal for cutting-edge information on health and nutrition.
Back to Intelligent Medicine, Dr. Ronald Hoffman here. Our number is 877-726-8255. And jot that number down because you've got a question, anything you'd like to run by me, you can call that number. And the way it works is you speak into the telephone or your handy mobile device, and you pose your question or you share your comment, and that gets recorded. And then it comes to me, and then I play it on the air. And then I answer it. So we'll take some of those questions momentarily. But first, I want to talk about how important the shape of your butt is. Okay? Interesting study they did on this. And, there's a lot of emphasis on the butt these days because big booty was a fashion statement for a while. It was to the point where women were getting butt implants, right? And I'm not sure why. I mean, I guess that appeals to some guys, big booty women. Maybe it has something to do with J-Lo setting the trend because she is curvaceous. And an example of which was Meghan Trainor. And one of her most famous songs is entitled All About That Bass. And you hear, it's a musical song, and you think, okay, it's about the bass line, and she says, because I'm all about that bass, no treble. But what she was talking about was her body type, which is that she had a big rear end, and she wasn't that well endowed up top. So it's kind of a body positivity message there's a lot of gals out there who are in the same predicament. The incidence of overweight and obesity is great, especially among young women, middle-aged women as well. So it was a body positivity message. Well, fast forward to the present, and she's totally transformed. She began taking Mounjaro. She lost some of that bass, what is sometimes referred to as junk in the trunk. And the lyrics to the song used to be, 'cause I got that boom that all the boys chase, and all the right junk in all the right places. In other words, big booty, junk in the trunk. Well, the junk in the trunk is gone, and lo and behold, she also got breast augmentation. So she's no longer like a cello with the big bottom and a small top. She's more like an hourglass figure, the ideal body type. So all this is kind of a prelude to talking about a study that tells us that glute shape predicts diabetes risk, but it's not the same for both sexes. I'm sure you've seen those types of guys who are overweight. It's kind of a stereotype of redneck individuals in the South. I mean, I got to say that, is that they got a big belly that overhangs, and then they have like a squared off butt. They got no butt, and their pants are falling down. Okay. And that is, in men, a particular risk factor for type 2 diabetes, metabolic syndrome. Researchers in the UK used three-dimensional MRI to study how age-related changes in the shape of a person's rear end were associated with an increase in type 2 diabetes risk over time. And the results differed by sex. In men, having a flat butt, not a big butt, was associated with a higher diabetes risk. In women, it was the converse. In men, type 2 diabetes was significantly associated with a flatter bottom And the opposite was true for women. So why would that be? Well, with an MRI, you can see not just muscle, but you can also see fat. And what happens as you become metabolically unfit, your muscle is infiltrated with fat. So a big butt in a man might be more likely to be associated with stronger, bigger gluteal muscles. And in women, it might be suggestive of something called fatty hypertrophy, which is fat infiltration of the butt muscles. The researchers say, we were surprised, not just by the scale of the differences, but by how sharply the muscle shape patterns linked to type 2 diabetes diverged between men and women. So this actually is interesting because they can now use MRIs. Look, we have really crude ways of diagnosing whether people are overweight or not. And they don't take advantage of the possibility that there's fat distribution changes within the body. And there's some people who are fit and seemingly kind of chunky, and there are other people who are relatively thin, but they have deposits of fat in their viscera. Visceral fat is associated with insulin resistance, prediabetes, and risk of cardiovascular, cerebrovascular disease, and all manner of problems. They say we also found that people with a larger gluteus maximus at baseline had a subsequently lower future risk of developing type 2 diabetes. Now, there's also implications for exercise. And I got to say that one of the risk factors for having underdeveloped glutes is sitting. And most of us do a lot of sitting. And I have to say that if I could go back in time to when I was in my 20s and 30s, I would do more in terms of exercises like squats and deadlifts, the kind of exercises that actually accentuate the glutes, because it's kind of use it or lose it when it comes to the glutes. And the glutes, big muscles, are repositories of useful tissue which releases what are called myokines. Myokines actually, it's not just having, bulging muscles. Myokines actually have a hormonal effect, and they may help to counteract diabetes. Those big butt muscles, and of course other muscles, like thigh muscles, your calf muscles, but the glutes are big muscles. They support your back as well. Very important in terms of alleviating subsequent back pain. Suggestion is work on your butt muscles, do those wall squats, do whatever you can to support your glutes, because your glute shape predicts your diabetes risk. I'm Dr. Ronald Hoffman. 877-726-8255 is our number, and this is Intelligent Medicine.